remember one of the first articles I read was, I think it was Gal Egan's article, and it was 68 catheters. It wasn't a huge one, but there was a significant difference in completing the intended therapy. And that to me was big, because there were so many times I'd hear, well, the line came out at home care enough that the doctor decided to switch to orals early and hoping it works. And then, sometimes we have rebound patients, or repeat offenders, I'll call them, but they come back in because the oral therapy was not good enough. And then we had to replace the lines again. And so, and this time you had to replace it, not just exchange it. And then there were others that we get a call and say, well, it came out this far. And you're like, well, we might need an x-ray. And then you see the x-ray, it didn't come out like 3 or 4 centimeters, it came out about 10, and they're no longer central at all. And is it that subclavian vein good enough to finish 5 more days of that antibiotic? We have to weigh all this stuff out. And I had that one patient come in that we were like, every IV came out. She claimed her body was rejecting it, but every IV came out. They lasted maybe up 30 minutes, maybe a day. She wound up going home with a PICC line my colleague put in her dominant arm, thinking that might help. And 2 weeks later, her body rejected it. So they admitted her again. She was going through one IV after another, and then they called me. And I asked for 2 days, and I got a couple samples from my rep. And so I waited 2 days to get my product in, and I went and put the line in. And I remember when I was putting the SecurAcath in her arm, she said, "What's that?" And I said, "Oh, it's nothing you need to worry about. It's a securement device, a little different than the previous one you had." And she couldn't get it out. And so it stayed in until she cut the catheter. But I proved that it could work, and everyone loved it. And my rep was great about getting to the home care nurses as well to make sure that they knew how to do a dressing change, and everyone was thrilled. I have not been this excited about a product in years. I have to tell you, I am just so excited about it. We haven't had one infection. We haven't lost one catheter. Home care and nursing on the floor are coming up saying, don't ever get rid of this product. I don't have a heart attack to changing a stat lock anymore. This is wonderful. And it's just been a relief, a real relief. Patient satisfaction went way up. The nursing satisfaction went way up. Our patients completed therapy, the intended length of therapy. It was wonderful. You can't just say this product is more expensive than this product, because the ultimate is the whole length of therapy. If you use this product, whatever that product might be, and you have migration of the catheter tip, do you have to exchange it? That's taking your time, the product, the patient's delay in therapy, more x-rays. Did we need all of that if you would just use this product? And that's what I kept trying to explain to management as well as the value analysis committee and purchasing. And in the end, everyone agreed. It just really decreased that. It's been remarkable. I'm just really so excited. To not have to replace a catheter is just wonderful.